Hello and welcome to another episode of Care Across Cultures. I'm your host, Perveen Hussain. You are listening to us on Link FM 96.7. We're also available on DOB and online. DAB. Today on Care Across Cultures, we're marking something very special. It is World TB Day. And we'll be talking about tuberculosis, often called TB. Now, TB, cancer and many serious illnesses often start with small symptoms. Fear, myths and stigma often stop people getting checked early. Early testing can mean treatment, reassurance and better outcomes. Support services, including hospice and palliative care, are about living well, not giving up. So before I go to my guests, just a disclaimer, the views and opinions expressed are those of me and my guests and not necessarily of the organisation that we represent or of Link FM. So with all that in mind, I'd like to bring in our guest today. Well, I've got 3 guests actually, which is amazing. Unfortunately, you can't see them today because our Facebook live stream is not working. So we have Perveen Ali, who is a TB nurse, and she's here to help us understand TB properly, what the symptoms are, how testing works, and why getting checked early really matters. With TB, we also have Anna Newland, who is the TB lead. And we have Sarah Rasnick, who is, job title is TB clerical. I don't know what that actually means, but we will find out later on in the programme what that actually means. So, Perveen, welcome to Care Across Cultures. Let's start with a little bit about you. Who are you? What do you do?
Thank you for your welcome. Assalamu alaikum, everyone. My name's Perveen. I am a TB nurse. I am work in Sheffield and we serve the Sheffield population. My job role is to give out information about TB, explain to the population, to the public, and make awareness. Don't be afraid. And with the awareness, we also offer information, advice, testing, screening, treatment, and that's for all the population in Sheffield.
Thank you so much for that. So, Perveen, tell me a little bit more in detail now, and for our listeners, World TB Day. What's all that about?
Okay, so today is World TB Day, and what its aim and purpose is to learn about TB all over the world, and it reminds us that TB still affects many people, not only in other countries but also here in the UK. Today is important because some people don't know the signs of TB, or they may feel worried or embarrassed to talk about it. When we talk openly, we can reduce that fear and help people understand what that TB can be treated, it can be cured. The earlier someone gets checked, the easier it is to treat. World TB Day is a chance to encourage people to get help early and to remind everyone that support is available.
Fantastic, thank you so much for that. Now, Anna, I want to come to you and help us understand what TB is. So let's start with the basics. Some listeners may not know.
Okay, so TB is just an infection. It's just caused by bacteria, like all infections, like we have flu. The bacteria will enter the body through the air. For example, when somebody with TB in their lungs coughs, we breathe, so we get the infection. Most of the time the bacteria will settle in the lungs, but it's important to say that TB can affect other parts of the body. It's not a new illness, TB. It's been around for a very, very long time. But the good news is that today we have the right medicines to treat it. It can happen to anyone, at any age, in any country. It doesn't matter where you're from, what work you do, or how clean your home is. It's simply an infection like many others that we see. When TB affects the lungs, people might get a cough lasting over 3 weeks or feel very tired. But when TB affects other parts of the body, the symptoms can be a little bit different, and that's why it's so important to get checked if something doesn't feel right. What I want listeners to really hear is this: TB is treatable and it is curable. With the right antibiotics, most people will make that full recovery. Treatment is free on the NHS, and you'll be supported throughout the whole process by the Sheffield TB team. So TB is something to take seriously, but don't be afraid of TB. We're here to support you.
I just another question on top of that, because you did mention Sheffield, but all across the country there are TB teams, nurses like yourself, and people can just sort of access that from anywhere, can't they?
So in the UK there are TBNURSES, what we liaise with, so we attend meetings, so we understand what's coming out new with treatments, etc. But we're one big family, I would say, the TB community throughout the UK.
Thank you. Perveen, people often think that TB only affects the lungs. That's what I've always thought. Mm-hmm. But I've recently found out that it can sort of affect different parts of the body.
Yes.
So can you explain a little bit more about that, please?
Nirvan, you're quite right. It does affect the lungs. But I must point out that TB is not selective. It can affect other parts of the body. For example, places like the neck glands, the bones, the kidneys, the spine, any other area. It's an infection. An infection can affect other parts of the body as well. So this kind of infection, where it is not in your lungs but in other parts of the body, it's called extrapulmonary TB. So that kind of TB may require different kind of testing, but it's still treatable. So no matter where the TB is, which part of the body the TB exists, the treatment is good and people do recover.
Thank you so much. और जी हाँ, जो आदमी हमारे सुनने वाले इंग्लिश इतनी समझ नहीं आती, तो अभी परवीन कह रही थी कि मैंने सवाल किया कि टीबी तो हम सुनते थे सिर्फ वो फेफड़ों लंग्स को अफेक्ट करती है, लेकिन नहीं, टीबी जो है ना बॉडी के किसी के हिस्से में भी आ सकती है. तो परवीन ये कह रही थी कि जिस हिस्से में भी आए ना जिस्म के, उसका इलाज है. और लेकिन अहम बात यह है कि जल्द से जल्द जो है ना आप उसका इलाज कराएं. So thank you for that. So Anna, we've talked a little bit, mentioned about early diagnosis, early treatment, and one thing that causes a lot of fear for a lot of illnesses is hearing the word TB. Yeah. How important is it for people to know that TB is actually treatable and curable? You've said already that it's treatable and curable, but what can we share with people in terms of what can they do and what is the treatment, those kinds of issues?
Yes, that's really important to say that. Many people hear the word TB and they feel scared because they remember stories from the past. And there's a lot of stigma still around TB. But today we've got strong and effective medicines and they're easy to take. And obviously the TB nurses play a vital role in supporting that individual. Most people who take the full course of the treatment get completely better. TB is serious, but it's also curable, like you said. People should feel hopeful and not afraid. And we have a wonderful team of TB nurses in the UK who can offer that support throughout the patient's TB treatment. We're here to support, we're here to listen, and we're here to treat.
Have you got and this is a little bit of an aside, but have you got a sort of a story of a patient that came to you with these kinds of worries and fears and stigmas that you would like to share with us?
Yes, so our work is very varied, and we often support people who have just arrived in the UK who might be seeking asylum. And the Sheffield team offer testing. And we once had an individual who came over who had signs and symptoms and very embarrassed about it, and didn't reach out into any healthcare setting. He felt there was a lot of stigma, he felt it was a dirty disease, but with reassurance that it isn't any of the things that we've mentioned, we built up his trust. He allowed us to come in and see him, and we got him through treatment within a 6-month period, and he's doing extremely well. He still keeps in touch with the team, writing to us to let us know what he's doing with his life at the moment.
Well, I think that's a wonderful story, isn't it? Not only helping someone overcome the challenges, especially in terms of fear and misunderstanding, yeah, but also that he's still in touch with you.
Yeah.
Isn't that
what
a wonderful
I would
story?
say about our patients is that we treat them as though they are friends and family. And when we get feedback from them, when they evaluate the NHS care, that is what they write. And to that, it's wonderful that we have took part of their journey. They've allowed us into their worries, their fears, how they've arrived in the UK, what they're going through at the moment. And we treat them like that, friends and family, and it's so important. And I think that's what TB nurses do so well.
And that's, I think, much wider. That's the NHS, isn't it? I always say it's our NHS. Well, I actually say it's my NHS. But it's our NHS, isn't it?
It is, yeah.
And, you know, there are people, you know, out there who sort of, you know, always bringing the NHS down. We're not perfect. But stories like the one that you've just shared show us there's the human side.
Human side,
Yeah?
yes.
And that we actually do care and we are here for everyone. But Perveen, I want to talk to you now a little bit about some of the common myths about TB and how it spreads. How do people actually catch TB? Is it something you get from touching surfaces or from being in the same room with? Because you said earlier that, you know, it's about breathing as well, isn't it? Yeah.
Yeah.
So
yeah.
can you catch it from someone?
Yes, TB is spread through inhaling the TB mycobacteria from the air because it is airborne. So if I gave you an example, and I can give myself as an example, say I had been in contact with someone who had TB infection, and this infection was in their lungs. So they would be quite ill and coughing and sneezing, and because of the coughing and sneezing, you find the mycobacteria is released through the cough, through the sneeze, into the air, into the atmosphere. So I am in close contact with this person and I am breathing in the air, but I'm also breathing in the mycobacteria that's in the air from this infected person. Now, I just want to also explain that I would have to be with this person for many hours.
Right.
For a regular contact. And not just by being in there for 10 minutes or an hour, but I would need to be in regular contact for many, many hours.
So it would affect someone living in the household with that person
yes,
more?
Or working.
With
somebody, and you're in regular contact with that person. So, in other words, it does not get passed on by touching door handles, touching surfaces, or just talking to that person, because this mycobacteria is not an ordinary bacteria. It is more sophisticated, so it's not passed on that way. So it is concentrated through many hours of contact and breathing in this mycobacteria, and eventually it's entered my body, and it can do two things: either go to sleep or it can activate straight away.
Okay.
And I get
So,
active TB.
just a further question on from that, for to help our listeners understand that if someone within their family has got TB, okay, and they're living in the same household and they're in contact all the time, 24/7, what can they do to sort of safeguard themselves?
Okay. Well, first of all, ask your relative, or the person who's living in your house. You're not very well. I see that you're coughing a lot more, and I can visibly see that you're weak, and day by day you're deteriorating. Your health seems to be deteriorating. I think you should be able to make an appointment with your GP, go to the doctor and get yourself checked out. So that's the first advice. The sooner the better. Go to your GP, make an appointment, see your GP, explain all the symptoms that you've experienced, and the GP is there to help you, give you advice, and also be able to do the necessary test for this. Yeah, and the people in the house, I mean, they would not be aware that this person has TB. So if they were aware, what they'd be able to do is take precautions, is just being careful. But the first instance is if this person has got active TB, that's been to the GP, and it's been diagnosed as active TB, the healthcare system will provide them isolation. What will they do? They will find them a bed in hospital.
Right.
Person will be admitted, so that's where they'll be in their own room, and TB treatment will be started immediately. So the rest of the household would be protected. And
would they also be tested, the rest of the household?
Yes. Eventually, the community TB team will be involved, because the hospital team will inform the community TB team. We will be involved. We will make contact with the patient and ask them, who have you been in contact, the members of the family, and the family will be offered testing as well.
So, thank you for that, but I've also heard of something called latent TB. I think you mentioned active TB. So if there's an active TB, there's got to be something that's inactive. Is that what latent TB is, or is it something different?
So latent TB is inactive TB. And active TB is a person that has TB and they have been infected by the TB mycobacteria, and they have all the symptoms, which is cough, maybe sometimes not a cough, but if it's pulmonary, it can be coughing, coughing more than 3 weeks, loss of appetite, losing weight, feeling generally very, very tired, lack of energy, losing weight, and having night sweats. Now, I just want to explain about the night sweats. It's not ordinary night sweats. They are called drenching night sweats.
Right, okay.
And they'll find out in the middle of the night they are drenched with sweat. The clothes are drenched, maybe even the bed covers are drenched. And so these are the symptoms of active TB. They may have swollen glands, and just feeling very ill, experiencing fevers and chills. So that's active TB. Now, latent TB is where no symptoms occur at all. The person is well, they carry on with their daily routine, they don't even know that they're ill, they're not ill, they're not experiencing any symptoms, so they are not ill. And what's basically has happened is this person has breathed in the TB mycobacteria, it's entered the body, and the mycobacteria has gone to sleep. And so we call that latent, or some people call it dormant TB. So it's gone to sleep, not causing any symptoms, not causing any harm, and it will just remain there.
Okay.
The person is not aware that I've got this latent TB. They carry on as usual, and with time, and due to predisposing factors, if the latent TB mycobacteria has an opportunity to wake up and activate, it will.
Okay.
And once it's activated, that is when all the symptoms
And we'll
begin,
sort of start again.
and it turns into active TB.
So once it, in its latent state, inactive state, they can't pass it on, can they? Or can they?
Yeah, that's a very, very good question. I'm glad you mentioned that, because I'd not mentioned it. No, they can't pass it on because there are no symptoms. No symptoms produced, so they cannot pass it on to their family members, their friends, work colleagues. It's not passed, it's contained until it has woken
It
up and
activates
activated.
itself.
Yeah.
Okay. Thank you so much for that. Anna.
Can I just say, I think
Yes.
it's important to say that obviously in Sheffield at the moment we offer screening for latent TB.
Right.
So Sarah, being clerical, will contact individuals who are aged between 16 to 35, who were born or spent more than 6 months in a country where TB is more common. So we get the information from UKHSA colleagues. Obviously, we carry out something called a blood test.
Come back to Care Across Cultures with me, your host, Mirban Hussain. I've been talking to the amazing nurses from the Sheffield NHS TB team. And we've been talking about TB. I've learnt so much today about TB. Some of the fears, some of the myths, some of the stigma surrounding TB, early screening, early diagnosis. It is curable, it is treatable. And there are lots of parallels with cancer as well, because some of the symptoms they were talking about is that, you know, GPs say that if you've been coughing for more than 3 weeks, book an appointment just to get it checked out. And I always talk about it could be lung cancer, but it could be TB. Yeah, TB definitely curable, definitely treatable. The earlier that you can get there, the better it is. So, and I want to start with you, if that's okay. Who is most at risk of TB in the UK today?
So some people have an high chance of getting TB because of their past exposure, not because they've done anything wrong. So, for example, people who were born in or lived for a long time in countries where we know that TB is more common may carry the bacteria without knowing. Bean's already talked about latent TB, and that's what we see. There's people with certain health conditions that weaken the immune system, and they can also be at higher risk. And of course, anyone who's been in close contact or long-term contact with someone who has active TB. So we've talked about those family members and being in close contact. It's not about blame, and it doesn't mean someone has done anything wrong. Risk just helps us understand who might need testing or support from the TB nursing team. It's an infection, and I think it's important to say TB is just an infection that can affect anyone.
Why would you say it's important to talk about risk without blaming and labelling communities?
I think we see it on the news now, don't we? There's lots of blame in society, and At the end of the day, we know that we have TB in the UK, and we're just here to do health promotion with individuals to make them aware of signs and symptoms. But we don't need to blame anybody.
No.
At the end of the day, we're not here to judge.
No.
People need to come forward, as Perveen's talked about signs and symptoms, and be checked out. If you went to your GP or had flu for more than 14 days, you would go to your GP.
Yes.
And at the end of the day, that's what we want to encourage. People need to reach out to healthcare settings if you think that you're unwell.
Thank you so much for that. Perveen, I want to come to you now, and we've mentioned testing. So let's talk a little bit more about testing. If someone is worried and comes forward, what does a TB test actually involve?
Okay then. Yes, we have clinics, especially for this purpose, the testing. There's two clinics. There's the latent TB clinic, where, as Sarah mentioned earlier on, a person receives a phone call, they're invited for an appointment to have a latent TB blood test, and all they need to do is book in, and it's a simple blood test. Procedure only takes about 15 minutes in clinic, and the person will receive their result after 10 to 14 days later.
Okay.
They'll receive a confirmation.
So it's got to be
of
sent
their
away
result.
something, it's not
Yeah,
something...
yeah,
Right.
the bloods get sent away to be tested out of Sheffield.
Mhm.
When we receive that result, we inform the patient. So all patients receive all their results. The other clinic for testing is, like I mentioned about the person who had signs and symptoms and went into hospital and started treatment for active TB. So the TB nurses will identify the names of all the members of the family, friends, or close contact, these members, close contact, or work colleagues, and then we will have another clinic which is called a MON2 clinic. The relatives and friends that they're invited to this clinic is a formal appointment, and what it involves is a small amount of tuberculin, little injection, just instilled beneath the first layer of your skin on your arm, and then the person returns 2 days later with another appointment, and what we do is look at the arm and see the reaction.
So is that... Well, sorry to stop you, but interrupt. But is that thing that jab we used to have at school?
6 needles.
Yes.
Yeah, the 6 needle one.
Yeah, exactly.
Was it called the Heath test or something?
It's called Heath test.
Right. Okay.
Call it MON2
Yeah.
testing. Yeah.
Yeah.
So all it is a simple skin test. You know, to explain to people in simple terms, it's a skin test. It isn't called a MON2 test. And so the patient originally has the first appointment for the skin test. The second appointment is to look at the arm, look at the reaction, and it's measured.
Right.
So an experienced TB nurse will have a look at the arm, measure it, and we have guidelines
Yeah.
on the measurements and what each measurement equates to a result. So, and if it's a positive result, then full information advice is given to the patient with lots of reassurance, and we refer them to hospital where they will be seen by the specialist team, the consultant in infectious diseases, and a person will attend their appointment, have a chest x-ray, and a full history will be, medical history will be taken, medical assessment, and you know, they will be given advice on what next steps to take, whether they need treatment or not, which the patient will be involved in that discussion and will be able to decide what they'd like to do.
This is a really important point that I would like you, if it's okay, to... some of our listeners may not understand English very well, if you could share a little bit about the testing, the HIV test, yeah, and what it actually means in Urdu, if very briefly,
Okay.
just to put their mind at rest.
Okay. जी हाँ, आपको ख़वातीन को तसल्ली देने चाहती हूँ कि परेशानी की कोई ज़रूरत नहीं है। ये जिसको हम कहते हैं मॉन्टू टेस्टिंग या हीव टेस्टिंग कहते थे, इसको स्किन टेस्ट भी कहते हैं। अगर आपको स्किन के टेस्ट की ज़रूरत पड़े तो मामूली सी दवाई है ना, उसको कहते हैं ट्यूबरक्लिन, वो बाजू में ना लगा देते हैं इंजेक्शन के तरीके से। फिर 2 दिन के बाद आपको फिर दोबारा हाज़री देनी पड़ती है हमारे क्लिनिक में, और वहाँ पे है ना फिर हम आपका ना बाजू को है ना हम देख सकेंगे कि रिज़ल्ट क्या है, कि ये रिज़ल्ट नेगेटिव है या पॉजिटिव है। अगर नेगेटिव है समझ ले कि सब कुछ क्लियर है और आपको फारिग कर देंगे। अगर पॉजिटिव है फिर आपको है ना अस्पताल की तरफ रेफ़र करा देंगे, वहाँ पे है ना डॉक्टर के साथ आपका रब्ता होगा।
Thank you so much for that. Anna, I was going to ask you about the skin test and blood test, but Perveen has explained it so well.
And I think what we need to say is...
Is there something that you want to add?
Most people tell us the tests were much easier than they expected. And the explanations what are given. Like I say, there's a lot of reassurance when people come in for their test and when they come back for the reading of MON 2. And I think as long as individuals know the process of what we're going to do, referring them into secondary care if needed, and at the end of the day, the patients will come back to us if they start treatment, so they've got a friendly face there.
Yeah.
So they know.
I think that's really important, isn't it? Because, you know, going through something like this because of the fear, and I'm going back to what happened during COVID, and all of the furor about, you know, the injections and what happened and who got ill, and there was so much controversy out there, isn't it? And I think it was only a few years ago, really, and there are some people who may still be sort of concerned that, oh, you know, what's going on here? But, you know, you've just reassured us that this is just a simple, straightforward test, yeah, and treatable, curable. Just reach out.
Yeah, and to remember, we're on that journey with you while you're on your treatment. We won't leave you if you're struggling or anything like that. The admin will be able to take phone calls, but we're on that journey with them.
Yeah.
So our bit is to start them on the treatment with the consultants like we see in secondary care. They'll come back into community care and we support them. And we're there to listen to their worries, their concerns, if they're experiencing side effects. So meeting that friendly face, whoever does the testing, we're there to support you.
I think one of the things I've picked up from what you've both been saying, and especially from you, Anna, is that this whole family sort of unit sort of thing that you create, and I think, is that something just you do as the NHS in Sheffield, or is this something that's sort of replicated across the whole of the UK?
TBNURSES are like that.
Yeah.
We always talk about it when we have meetings, that we talk about our patients being family, and everybody shares that same passion and same commitment to their patients.
Fantastic. And it's so wonderful to hear that, because I hear that from palliative care nurses and many other areas of the NHS. Unfortunately, we also have some sort of small areas where, you know, patient care hasn't been fantastic for some people. But one of the key things that I want to mention is that the NHS is our NHS. We are here for you, the people. Come to us. Come and ask. You know, reach out, because that's what we're here for, and we're here for you. That's really, really important. So the other thing I want to ask now, we've talked about positive treatment, you know, positive test and then a treatment, yeah? So, and who supports, because you as TB nurses will support them throughout the whole process. Let's talk a little bit about the treatment itself in terms of antibiotics. My wife had TB, 36 years ago, and she was in hospital for 6 weeks. Now, prior to that, an uncle of mine, I think about 20 years earlier, had TB, and he was in hospital for about 3 months. So how has that changed now in terms of so that people can, our listeners can understand what the treatment, is it a hospital stay, is it not, and how long that sort of lasts?
So I think as Perveen mentioned, obviously if you're infectious and you're unwell, yes, you might be in hospital for a short period of time, but we have excellent antibiotics now which we know can cure TB. And most often than not, patients go into their clinic appointment, they start active treatment, and they go home the same day. And that's where the TB community nurses support them. So the referral is made back to community from secondary care, and we pick that individual up and again support them on the journey.
Them.
So yes, maybe individuals may have to stay in hospital, especially if they're unwell and they've got the signs and the symptoms and feeling generally lethargic, not eating and drinking. The secondary care will do a fantastic job of looking after you. But it's important to say that you will come into community care and you will eventually go home and be supported. But the treatment that we see now is that it's less tablets. I think probably years ago they used to use injections to treat TB,
Yes.
so that might be what your uncle had.
Yeah.
And they were put into isolation for 6 months up to a year.
Yeah.
We don't see that now. People are able to go home and live a normal life.
And I remember one of the things is that, the food that they got was amazing. There was lots, it wasn't hospital food, it was hospital, but not, not standard. And they could also smoke as well. Yeah, that was it's got to be about 50 years ago. It's got to be 50 years ago. And they could do that. But obviously things have changed now, moved on. Okay, thank you so much for that. So,
can I just mention about the latent TB?
Yeah.
So sleeping TB treatment, just a few words, differs compared to active TB treatment that Anna has just explained. So with sleeping TB, which is called latent TB, and they are the people that don't have any symptoms, they are not ill, and their treatment is different by way of they have a 12-week course of antibiotics, so 2 kind of drugs that they use, and the patients are supported throughout the 12 weeks until they've completed all the treatment. So we'll support with regards to their well-being, signs and symptoms, and give them advice and information. And then once they've completed successfully, they receive a letter to say your latent TB has been successfully treated and has been completed. Right. So if in the future the patient are required to produce any evidence about their TB, right. For example, filling in job applications or travel purposes or right. Any purposes that any question comes up on a TB, so they have got some evidence there that yes, they did have latent TB and yes, they were fully treated and right. It was successful.
Successfully cured. Just a question on that, can it come back? What's the current thinking? Because my understanding was that we'd got rid of TB decades ago, but then there's been a resurgence. So could you shed some light on that, maybe, Anna?
Yes, so TB can come back, if it's an infection. So, like you said earlier, we breathe in the same air. So we may come into contact with somebody who has infectious disease with TB and breathe that germ in. So unfortunately, yes, it can come back. But as long as you know the signs and symptoms, what we've discussed early enough, to go and seek out health care, we can get you sorted out, we can get treated. I think it's important to say that TB is treated and it's curable nowadays. But like Perveen's just said about the antibiotics, it's important to finish that full course of antibiotics. And sometimes we know that people lead busy lives and they may miss doses.
Yes.
But what we say to them is be honest with us, because we'll just add it in. We're not there to judge and go, you've not taken your antibiotics. Yes. We'd like you to be honest with us and say, oh, actually, I had a busy few days and I missed 3 days of my treatment. that's fine. We're not there to judge. We're there to support.
Because life intervenes, doesn't
Yeah,
it?
and life's so
Yeah.
busy.
Life is busy.
You know, like Perveen says, 12 weeks of antibiotic therapy. We know it's such a long time. But what we do well is give that support out, like all TB nurses, and we get them through the treatment programme.
So, if someone misses a couple of doses, maybe a couple of days because of whatever reason, and they tell you,
Yeah.
what would you do then?
We'll just add it towards the provisional end date. So we just roll it on and just say, don't worry, carry on, and we'll just add it on.
So it doesn't really have that much of a negative impact then on the person
if it's
themselves?
a long period of it, then unfortunately we would have to start again the treatment.
Right, okay.
But because we're supporting them, and obviously we've built up a relationship with the individual,
Yes.
they're open and honest, and that's what we appreciate. Again, going back to, we're our family.
We are family.
And that's what I'd reiterate all the time, you know. We're not there to judge, you know.
So just another question, and I was just thinking that, is there a particular group of people, I'm looking in terms of maybe cancer or other sort of life-limiting illnesses, who are more sort of susceptible to catching TB? Or is it not?
Yeah, so unfortunately, obviously, people with weakened immune systems are at risk with any infection, not just TB, unfortunately. But again, as long as you know the signs and symptoms and you can go and access healthcare, then please access it and explain this. And obviously, by undertaking this health promotion station today and promoting TB, people are more empowered.
Yes.
That you can go to your GP and say, I've got this symptom, this symptom, this symptom, and I heard of something about TB.
Yeah.
You know, TB is not eradicated; it's still out there.
It's still out there.
It's still in the UK. But unfortunately, people with weakened immune systems are at risk.
Thank you so much for that. We are sort of coming to the end of the programme. If you just tuned in, you are listening to Care Across Cultures with me, Mehrban Hussain, your host. I've been talking to the wonderful nurses from NHS Sheffield, the TB nurses, Perveen, Anna and Sarah, who've been sharing some valuable information about TB, signs, symptoms. The most important thing is that it is treatable, it is curable, and recognise the symptoms and the signs and seek help straight away. So, Perveen, you wanted to add something.
Thank you. Just going back to the latent TB and the 12-week course of treatment. So I did say treatment, but actually it is a prevention treatment. So the person is not ill. They do not have the signs and symptoms of active TB, so they don't feel unwell. We give them the treatment, give them the antibiotics to prevent illness occurring, to prevent, you know, the mycobacteria from waking up and activating and becoming active TB, making the person ill and experience those signs and symptoms. So the latent TB is a prevention. So prevention,
which is such an important clarification. Thank you so much for that. So now we are coming to the end of the programme, so I'm going to ask each of you now, what one last message would you like to leave with our listeners? And I'll start with you, Anna. One last message.
If you are worried about TB or have any symptoms, then please go and access healthcare. Go to your GP and discuss that. Just keep the signs and symptoms at the back of your head, and explain that you've heard the programme today and you'd like to be tested.
Thank you so much for that. And the signs and symptoms: a cough for 3 weeks, night sweats, lethargy, loss of weight, you know, fevers, that kind of thing. And I like the night sweats that you talked about, Perveen, because you said we're not talking about it sort of, you're soaked, aren't you? You know, yeah, you're soaked in it. So, Perveen, what last message would you like to leave with our...
I'd like to say to our community out there is, if you receive a phone call for latent TB testing or any TB testing, please take the opportunity, accept the appointment, get checked out. It's a simple blood test. Please attend. It's for your benefit. If it was myself, I'd rather know if there was anything wrong, then I could take active steps in doing something to promote my health. So please don't worry if you receive that phone call. It is the NHS, and this appointment is available for you, free of charge. Please accept the appointment.
Thank you
Please
so.
come.
Thank you so
I
much.
think from that, Perveen, I think obviously we just need to say that it's completely free, the test.
Yes.
It is.
And treatment is free, and it's curable.
It is.
And I think all TB nurses would echo the same thing, that we're here to help you with kindness, be supportive to you, and get you through that treatment without any judgment.
Thank you so much. And finally, but not, Sarah, out of all of this, I found that, you are sort of a linchpin, aren't you, in terms of the community, because you're one of the team that actually phones people. So what would you like to what would you like to leave with
just, if you do receive a call or you receive a letter from us, just, either give us a ring or, when we call you, book into clinic and, and take the test. And just to reiterate probably what Perveen said, really.
And no question is a daft question.
No.
No.
Exactly.
Yeah, so if anybody has any questions or anything, you can contact the TB nurses on 0114 3078 390.
Thank you so much for that. So that's the end of the programme today. You've been listening to me, Mirbon Hussain, your host on Care Across Cultures. I will be back next week with some new guests. Allah Hafiz and goodbye.
Allah Hafiz.
Well done.
Well, yeah.
Is it